They're not going to go to their coach and tell them they're feeling bad at all because they know what's going to happen if they tell their coach that.
It's part of the warrior mentality many athletes were raised on, brushing off a hard hit, but medicine is paying close attention to the damage from repeated hard knocks.
A second head injury coming in very close, temporal proximity could be severe with devastating consequences.
Neurosurgeon Dean Lynn is educating fellow healthcare professionals about the dangers of allowing teen athletes to take the field too soon after a concussion.
Not always is diagnosis easy. There's certainly been lots of times when people have gotten a hit on the head. They may be a little groggy, a little dizzy for a little bit. They get up, they keep playing.
Research indicates younger, less developed brains are at greater risk for second impact syndrome, which occurs when an athlete returns to their sport too quickly, then suffers another concussion.
The brain basically just swells more than the skull can accommodate. And the skull is a very rigid structure. It doesn't accommodate anything. So the swelling basically causes the brain to crush itself.
A player who suffers even a mild concussion should be benched for the game. And most guidelines agree a player should be out of commission for 7 days once their symptoms subside. But all too often, teams are quick to take to the practice field.
There have been numerous case studies and case reports about young players who've suffered 2 head injuries within a few days of each other, basically dying from increased intracranial pressure.
That's why caution should be the name of the game.
We need to educate ourselves better. We need to study the information better. We need to learn when is it going to be safe that your child can go back and play.
Important in protecting headstrong athletes. For Lee Memorial Health System, I'm Amy Osher.